Hi, this is Joy Yoder. I'm a midwife at WellSpan Ephrata Community Hospital. I'm doing a video series for my centering patients during the COVID-19 social isolation time period. But I want to make it available to all of our patients. This is going to be a very short video. I keep getting questions regarding perineal stretching during pregnancy to help prevent tearing during labor. And I thought I'd at least sort of say my piece on that. I know it's kind of boring to see me sitting here staring at you, but so it is. Perineal massage involves using a lubricant and 1 or 2 fingers to sort of stretch the vaginal opening. And you can use massage, sort of a circular motion, or just like a steady downward opening pressure. You can use your thumbs to do so. You want to be really careful not to go so hard that you cause severe pain or tearing to the vaginal skin. So hence the lubrication with mineral oil, KY jelly, anything that's water-based. If you look online, you can see a lot of different oils they suggest. Olive oil, something that's natural, won't cause irritation to the skin. The goal is to stretch the skin, stretch those muscles to sort of increase flexibility of that tissue, but also to kind of help ease those muscle tensions and tightness and give you just self-awareness of what is my vaginal muscles, when am I clenching, when am I releasing, so that when you're pushing, you aren't clenching those muscles and then fighting against your own strength, so that you know how to relax them so that the baby can come down through and you aren't working so hard against them. So it's an educational piece too for women as well, to sort of kind of be aware of those sensations. Again, it needs to be done. You might feel some burning or pressure. The opening needs to be stretched slightly, and then those muscles, it's not just the outside that you're doing in about 1.5 inches to hit the musculature and kind of see how that feels. At any point during this time, if you feel like you need to stop, please don't continue. I've had one woman say, she did another perineal stretching, she was just going to scream. I'm like, okay, at that point, probably you shouldn't be doing it anymore. The goal is to try to avoid tearing. Does this really decrease tearing or trauma during delivery? I would say that if it does, I don't know how significant it is. I think if you're comfortable with it, if you are learning things from it, great. But if it's causing you distress or you dreading it, or please don't do it. The benefits are not worth that. Tearing does happen in a labor. It can. Sometimes it doesn't. Sometimes we think, wow, I don't know how this happened, but with a good midwife and or just good skin tissue, there's lots of reasons why a woman might tear or why she might not tear. Her skin tissue integrity is important. Nutrition plays a role in how flexible a woman's skin is or how strong it is. Her control with pushing, and whether she's tense and scared and fighting, or whether she can stay relaxed, keep her legs relaxed, and deliver slowly, gently, easing that baby's head out. And some of that's the midwife's job, to help guide that and help support the perineum. And just sometimes even with all that we do, we can't prevent that tear from happening. Babies with their arms up, so like sometimes a baby will come through and it's not in this nice streamlined position, and it's got one or both hands at its neck, and as they come through, that arm extends and can tear the woman. So there's a lot of things that we can or cannot control for. So, what else might there be? So like I said, some women I think, wow, they're really going to tear, and then there's nothing, like maybe a little abrasion or a little skin split, and others who, they do tear deeply. In regards to that, yes, some women can have pain afterwards, or can have urinary issues, or can have incontinence issues, fecal and urine. Many women heal well. The perineum and the vaginal musculature is very vascular and bleeds a lot, but then also heals well and knits together well. And so just even a few stitches will help hold everything together. And sometimes even at the 4-week visit, I'm like, yeah, it's all together. It looks great. Like there's nothing there that even would tell me that you had a tear. And so the benefits of perineal massage, I think, in my book are sure, if you want to try it, we're willing to do anything, but it's not necessary at the risk of your discomfort or your fear. So I think that's kind of where you can look up directions to how to do it online. I mean, there's all kinds of things and ways they say to do perineal massage. During labor, sometimes we do use perineal massage. Sometimes we use it to help guide a woman's focus, especially if she has an epidural and she may not feel that pressure to push. We will use it to help guide her. Sometimes, occasionally, all I need to do is help just open those pelvic muscles just a little bit to allow that baby to slide through, and that's all I need to do. And so that's all I do. I have found that vigorous massaging during labor can cause trauma and can actually do more damage than good for a woman. I've also found that heat, while people think it feels good, will engorge the area, cause more swelling, and that doesn't necessarily bring about better results. It'll increase the risk for tearing and bleeding, in my experience. That doesn't mean it shouldn't be done, if that's something a woman desires or wants. And at Ephrata, we do use mineral oil during the labor, during the pushing process, just to keep that area lubricated and moist, and help with stretching. I'm trying to think if there's anything else that I think in regards to this topic. On that note, episiotomies, Ephrata has a very low rate of episiotomies. We only cut them when a baby is in distress and when the baby is actually low enough that an episiotomy will help release so that the baby can come out. And so we have very few episiotomies that are done. It's usually only in a fetal distress case. Yes, there are a few exceptions, but very few. And so you don't have to worry that we just randomly do them. We also will tell you before we do them. Usually we say something to the effect of, your baby's heartbeat is low and is not returning to baseline. It's right here, but I think you have a little more stretching that needs to happen, and I think it would be best not to delay the delivery of the baby, and so I'd like to cut an episiotomy. And so that's kind of how you should expect things to go if that's something we would like to do. So you're not surprised by it, and you know the reasons why. And usually you're very aware. We're talking to you about what's going on in the labor. You guys are part of that decision-making process. All right, I hope that was helpful in that topic, but I just keep getting questions from all of you about this, and so I thought I would give my opinion on